afternoon. Thanks again for being here. My name is Lauren Williams. I'm Adult and Community Services Manager for the Columbia Public Library, which is part of the Daniel Boone Regional Library System. Welcome to today's Lunch and Learn. Today's program is co-hosted by the library and the League of Women Voters of Columbia Boone County and presented by the Children's Grove. Today, we'll be learning about the very important topics of mental health and substance use and how to connect with and talk to kids about these topics. Now I'd like to welcome our moderator, current president of the League of Women Voters of Columbia Boone County, Barbara Hoppe. Thanks, Barbara.
Thank you, Lauren, and thank you, as always, to the Daniel Boone Regional Library for co-hosting our Lunch and Learn programs. I'm really pleased today that we're going to focus on mental health and substance abuse and making the connection with our kids. I wanted to introduce our speakers. Kim Dude Lammy is a former director of the Wellness Resource Center. Heather Harlan is a certified drug and alcohol counselor, a family support group facilitator for NAMI, the National Alliance for Mental Illness in Missouri and Columbia, or of Missouri and Columbia, and is also an active volunteer with the Youth Community Coalition. And then our third speaker is Laura Powell, and she is a prevention coordinator lead for Compass Health Network. And of all of our speakers today are also from the Children's Grove, and they with the Social, Emotional, Mental Wellbeing Committee. So thank you so much for sharing your information today. And again, please enter your questions in the chat feature and we'll take those at the end of the program. Now I'll turn it over to our speakers.
Hi there, thank you so much for having us. Can everybody see the PowerPoint? All right, thank you very much. So this is our agenda for today. We're going to talk about developmental prevention for parents and other caring adults, when caring adults should be concerned and what steps to take, and then effective prevention approaches for people who are older, like college age. And we would encourage you to take notes. We're going to share some resources and a lot of information during this webinar. So please feel free to take notes. You can also take screenshots. And as you were told earlier, this will be recorded. So if there's something you'd like to go back to later to get some more information, you will have that ability. As I was introduced earlier, I'm Missouri Prevention Specialist with Compass. So the first thing we're going to talk about is young people, is the youth. And they are always watching. That's why we have the camera at the bottom. You may have heard that quote, "Do as I say, not as I do." But when it comes to most people, and especially youth, they're watching our actions. They may be listening to what we say and they do care, but actions are much more powerful than words. So it's important when we have a rough day and we come home that we model what a good way to handle stress is. Maybe we go for a walk, maybe we take a bubble bath, or maybe we decide to play a silly family game that makes everybody giggle. Whatever that is, it's important to handle stress in a healthy way so that when kids are watching, they learn all these different techniques that can be used. What we don't want them to learn is we don't want them to learn that when we're stressed, we come home and we drink, because that is what some adults do, and that's not a healthy way to cope with stress. So it's important to have healthy ways of relaxing and to have those conversations that everybody has bad days and everybody goes through difficult things. And if you start those conversations young with your kids about how sometimes things are really hard, but we can talk about it and we can figure it out and we can get through it together. So it's just really important to talk about what's going on, and especially to talk about substance use. To have lots of conversations starting when they're young. It's going to look very different. When they're very, very young, it may look like medicine is what we take when we're sick, and we only take medicine from these specific people in our life. We don't take it from somebody on the playground, only from these specific people. And then of course, as it gets older, as the youth gets older, the conversation will change and evolve. During that conversation, one question that can really freak parents out is that, did you use substances? You're telling me that you don't want me to use substances, but what did you do when you were my age? And for some of us, we did make that mistake. Maybe you did use a substance when you were young. Maybe you did drink underage. It's important to be honest because it's going to be much worse if you lie and then they catch you in a lie later. So be honest about your experience. However, share only what's developmentally appropriate depending on the young person's age. They do not need all of the gory details, but you can give some details and frame it as a lesson. Frame it as you wish that you hadn't made that decision and maybe it did turn out okay, but you know that it may not turn out okay for others and that bad things can happen from that decision. So frame it as a lesson and really avoid glorifying substance use. We get enough of that from the media. If you see TV shows and movies that show substance use, usually people are having fun and everything seems great. They don't show the after effects of the hangovers or the legal consequences or missing school, whatever it may look like, isn't shown in the media. So make sure that you have those conversations. Believe it or not, youth really do care what their parents think. Whenever youth are surveyed, they say that even though they may act like they don't, they do care about important adults in their lives, what they think. So they need clear expectations and enforceable consequences. They need to know what happens if you catch your child drinking underage. You really can't say that you're going to ground them for life because that's not an enforceable consequence. Maybe they lose driving privileges for 2 weeks. Whatever that looks like in your family, you need an enforceable consequence that matches what that was that they did wrong. Make sure to be disappointed in the behavior or the choice and not the child. Guilt can be a great teacher. Guilt says, I did something wrong and I need to fix it and not do it again. However, shame says, I am wrong or I am bad. And we do not want to teach people that they're wrong or bad because they're not. So make sure that they know that you don't like the decision they made, but they are still loved and they can still come to you. As I mentioned earlier, have multiple conversations. This is not the talk that you have once. This is an ongoing conversation that can even start, maybe they have a classmate, maybe something happens at school, or maybe something happens at prom, maybe it's before prom. That's a great time to have a conversation and start very young. These are the Search Institute's 40 developmental assets. You can look these up if you'd like more information, and really they're just protective factors. And the external assets are something that, of course, is external, something that we can help build. And then internal is what they believe inside. So there are different things that we can do to increase these. And many of them are very, very simple. Like we mentioned the boundaries and expectations, and then constructive use of time, just having good things to do with their time is another helpful factor. Some resources, I mentioned talking about it with all ages. If you go to talkaboutitmo.com, you can click on the age group and they have all the way from preschool all the way up until teenagers who you think might be experimenting with substances. And it gives you ideas about how to talk to those different age groups. We also have the Partnership to End Addiction and Partners in Prevention, or mopip.org, is the college site. So now I will turn it over to Heather.
All right. Thank you. Thanks, Laura. One of the things that's not on the slide then is my volunteer work with NAMI, National Alliance on Mental Illness. And I'm one of the family facilitators for the family support group here in Columbia and Mid-Mo. And we're going to have this NAMI, wherever you're from, to look NAMI national organization, but there are also state organizations and local affiliates. So we hope you'll investigate that. It's a great resource for family members. Even if you have a loved one who's not interested in recovery or help, it's great support for family members, but also for the individuals who may have a diagnosed mental health concern. All right, next slide, please. So I'd like to speak directly to parents and caregivers and coaches, youth leaders, any adults who are spending time with youth. Next slide, please. So the question comes up, well, when should we be concerned? What can we do? What are the first steps we might take if we think there might be a problem? Now, one of the things I want to point out is that if you were looking for a presentation that had all the signs and symptoms and what kind of paraphernalia to look for, et cetera, this isn't going to be that presentation. That would take a lot more time than what we have right now. But since you're on this webinar, then we know that you're connected virtually. And in the link there, there's going to be a drugfree.org location that's a great resource to have those questions answered. But we're going to cover a step back and take a little bit broader strokes to look at when you should be concerned and what are the first steps you might take. Next slide, please. So first of all, we just want to pause and reinforce and re-examine, be sure that we all really understand at what age are human brains fully mature. About 18 years, about 25 years, about 30 years. So choose your answer. Next question. Next slide. So until recently, it was sort of a new thing, maybe 10 or 12 years ago, maybe even 20 years ago, where they realized, oh my goodness, the human brain really isn't fully mature till about age 20. But now within the past few years, there's more research that's coming out that is beginning to indicate it might be closer to 30 years. The human brain sort of develops from the inside out to the front to the back. And the last to develop is the prefrontal cortex right here, which does that decision-making and discerning thinking and moves us to forward thinking. So because the 18-year-old is taller than you are does not mean that that person is fully adult in how they're processing what is happening in their lives. Next slide, please. So we want to be able to really understand and grasp that the human brain is valuable and it's also vulnerable for many years, longer than we had previously imagined. And I won't go into all of these, but obviously there are many factors that affect health and maturation of the human brain. And some of these are maybe within our ability to manage and some of them are not. Next slide, please. So a lot of times, if you were here in person, I would ask, so what are some of those behaviors that our teenagers have that are kind of a hassle sometimes or difficult for us to field, that make teenagers sometimes challenging, delightful, but challenging to work with. And a lot of times when the things come up, well, they're really moody. Well, they're irritable, easily bored. I know one youth group leader said they had some youth that really, really wanted to go ice skating. Okay, so the youth group leader went through all kinds of, jumped through all kinds of hoops so they could go ice skating. And the youth group leader said, literally, 10 minutes after we got there, they skate up and say, so what are we doing next? So they're easily bored, short attention spans, maybe changes in eating patterns, disruptions in sleeping patterns, changes in interests and friendships, sometimes withdrawing from interests and friendships and family. You know, how they used to talk to you and now they don't. So that's really bothersome. And that, you know, that's just sort of, that's pretty, I'd say, within the range of normal development for teens. Okay, next slide, please. So the difficulty is that those are also, those attributes, moody, irritable, easily bored, short attention spans, changes in eating patterns, disruptions in sleeping patterns, interests, friendships, maybe withdrawing from family, can also indicate, those may also be red flags for behavioral health issues. Next slide, please. So then we have the overriding question, when should we be concerned? How do we know if it's just sort of normal teen development or at what point should we be concerned and it's a behavioral health issue? Next slide, please. I want to pause here and call your attention first to tobacco use and nicotine use. People often neglect to mention this, that if a young person is using tobacco, there is such a huge body of research that links teen use of tobacco with depression and anxiety, the correlation. There are some bodies of research that indicate it might be cause, you know, you're not getting as much oxygen, but I want to call every adult's attention. If a teenager is using tobacco, that by itself is enough of a reason to check into their mental health. You don't need another reason. Also, research indicates it's not unusual for teenagers to drink and not smoke. It's very unusual for a teenager to smoke and not drink. So that may be an indicator that there's also alcohol use involved with that very valuable, vulnerable underage brain. So I want to call your attention to that. That enough in itself is enough of a reason that there's a red flag, and we should further investigate their mental health. Next slide, please. So this is what, if you want a screenshot of this would be great. This is sort of a condensation of what we should be concerned about. How do we know? So asking yourself the question, might this youth be ill? ILL. And I really got this concept from the youth mental health first aid training, but I had to synthesize it in a way that I could remember it. So it's ILL. I, intensity of the signs that you see. L, length of time the child has been experiencing this. And L, limiting. How much is this limiting the youth's routine activities, school, work, and social life? So when you say intensity, of course, a child may get really mad and say, "You're the worst parent ever," and slam the door. But the intensity, if the child is punching holes in the wall and you fear for your safety and have to call the police, that's different. So on that continuum of how intense is this? Look at the length of time the child has been experiencing this. So when you ask, so how long has she been locking herself in a room and crying when she comes home from school because she didn't make the band? Well, it's one thing if they say, well, a week, 6 months, that's too long. Actually, a red flag is if there's a certain behavior that you think is concerning that's going on for 2 weeks, such as not being able to sleep even, that could be a red flag. The length of time is significant, so 2 weeks. L, limiting. How much is this limiting the youth's routine activities, school, work, and social life? We know teens through this developmental do a lot of changing around of things, but if it's limiting, if they're not able to go to school, et cetera, then this is interfering with their lives, and you should check into it. So again, to check with the question, how might this youth be ill? Intensity, length of time, and limiting. Next slide, please. So it's hard to tell again. So if you notice that ILL, even if you don't know, but collect information on what you've observed on intensity, length of time, and how limiting it is. And then for the next step, next slide, please. So what are the first steps we as parents or caregivers can take? Again, if we think, well, I've got some concerns here. What do we do next? Next slide. The first thing to do is to call the child's primary care provider. Secondly, you can describe the behaviors in your teen that you see that concern you, schedule a checkup, and request an evidence-based mental health screening. When I say call the child's primary care provider, not so many years ago, I would have thought, well, why aren't you calling a psychiatrist or a counselor? Well, the reality is, especially in Missouri, there's a huge shortage of those professional healthcare providers. Child and adolescent psychiatrists, there is a global shortage, and it's especially bad in Missouri. So your likelihood of being able to get that appointment, there may be quite a waiting list. Sometimes it's 6 to 9 months. Even the mental health care providers of counselors, there's often long waiting lists because Missouri is one of the worst in the country for having the right ratio for the population of professional health care providers. So the treatment system is shifting so that start with a primary care provider. They can begin to help with those mild to moderate situations and refer you as necessary. So call the child's primary care provider. Secondly, describe the behaviors, and we just discussed what you would look at, the intensity, the length of time, and how limiting it is. Schedule a checkup and request an evidence-based mental health screening. Now, some primary care providers may sort of chat with the patient or say, well, they didn't look depressed to me. But those methods of intervening and trying to assess a child's mental health status, well, we now have evidence-based screenings that are more likely to find those situations in which we should investigate further. So request an evidence-based mental health screening. Next slide, please. So I just talked about this, so why not start with it? The waiting lists are too long, especially in Missouri. Next slide. And what if you're worried that your child might be suicidal? And that's a question we need to discuss, and I'm going to bounce that to Laura to take us through that.
Yes, so the first thing that we're going to do is to pause for a moment and take a deep breath in and out, because just the word suicide itself can be really scary because it is life or death, and it is a very serious subject that can be hard to discuss. But all the research points to how we save lives is talking about it. So it's really important to talk about suicide. The first thing to do is to open up that conversation with your child or with the young person, and then ask them directly if they are thinking about killing themselves or if they're thinking about suicide. The research is showing, for the most part, that they'll be honest. They will tell you yes or no. And if the answer is no, maybe it's something else entirely, wonderful. Then they know in the future, if they ever do have a really serious struggle, that they can talk to you and that you're not going to be too terrified to talk about it. If the answer is yes, then we need to keep going. The next step is to ask them if they have a plan. They may just be having vague thoughts about everybody would be happier if I wasn't here, or they may be thinking, I'm going to use this thing on this date in this place. So a higher level of planning means a higher level of risk. However, a lower level of planning, just those vague thoughts, doesn't mean that there's no risk, because as we talked about earlier, young brains are still developing, so they can be very impulsive. And when it comes to suicide, impulsivity is a bad thing. So it's important to really get on the front end of it and assess, and then work together to remove the means. Whatever they tell you is in that plan, work with the person, work with the child to get it out of their reach. And especially with firearms, if that is their plan, and even if it's not their plan, it's important to have firearms out of reach of the young person. So it might look like a safe with a lock. And if you do that, make sure that you use a code that they're not going to guess. Don't use the child's birthday or 1, 2, 3, 4 or something like that, because youth are very clever. And if you've ever tried to hide Christmas presents or birthday presents, you know that even things that you think are well hidden may not actually be well hidden. So it's important to do something. Maybe the firearm goes to a neighbor's house or a family member's house for a little bit to get that out of reach. Listen. Just the act of listening can go a really long way, because a child may be terrified. They may not have any idea what's going on. They may not know what to do. They may not know that you know what to do. And even if you are scared yourself, which is totally understandable, we just need to do our best to appear as confident as possible so they know that we can help them and we can handle it and we're going to help them. So just listening goes a long way. We know that just getting those words out in the open can provide some relief for the person. Just saying it out loud goes a long way. Do not leave the person alone. Of course, if they're at serious risk, we don't want to leave them alone. If you can't stay with them, get somebody else to stay with them. And then reach out to the professionals. In Columbia and Boone County, you have the Rural Central Missouri Crisis Line, and the number is there. That is a great number to put in your phone. You may not need it right this second, but it may come up at some point in your life, and that is a local number. So they're going to know what resources are in your area and how to access those resources. So that's a great one. If you do not live in Boone County, there is an Access Crisis Intervention list that we can get to you, or you can Google it, and it will pop up whatever county you're in, what the crisis line is for that in Missouri. If you're not in Missouri, or if you're talking with somebody who's not in Missouri, we have the National Suicide Prevention Lifeline. And then there's also, not on here, but there is a crisis text line that you can contact as well. And those resources are all 24/7. And then of course, 911 in the hospital. Nobody wants to go to the hospital or to call the police. However, if you're in a life or death situation, that sometimes is what you have to do. So be aware that those are there, and you can take a person to the hospital to avoid an ambulance ride if that's safe, that's going to work for you. And if you call 911, make sure and request a CIT trained officer, that's crisis intervention training. And these individuals just have more training when it comes to mental health. They may be even more aware of what resources are in your community. So if you're calling 911, ask for CIT, and don't be afraid to call the professionals, because that's what they're there for. It is difficult to handle alone. And once you get the person stabilized, once they have some sort of resource or are in care, it's important to reach out for yourself as well, to talk to a loved one about the experience and the stress, and to do whatever you need for self-care, whether that's take a bubble bath, go for a walk, play a game, whatever you've talked about in your family as healthy ways of coping, because it is hard. And remember that thoughts do not have to become actions. There are a lot of people who have thoughts about suicide and they never do anything about them. They get the care, they get the support that they need, and then maybe they never have those thoughts again. There's therapy, there's support from loved ones, medication, and there are other treatments as well that can make a world of difference. So remember that you are not alone if you're struggling, and no one is alone if you're helping somebody who may be struggling. So please keep these in mind and reach out to the professionals if you have any concerns, because that's what they're there for. So I'm gonna turn it back over to Kim now.
Hello, everyone. I'm very pleased to be here. I was the director of the Wellness Resource Center at the university, which is the campus prevention office, but I retired a couple of years ago. I have over 40 years experience in higher education, and I'm happily retired and proud to say that I'm president of Children's Grove. As you might guess, because of my background, I'm going to focus more on college-age students. And so next slide, please. What I thought I would do first is to talk about some of the myths that are out there. One myth is that it's just a rite of passage to have students drink, and they drink a lot and everybody's doing it, and it's something that we have focused in our mind when we think about college students and alcohol. And the reality of it is that's not true. That not everybody is doing it. We did a lot of research on our students the entire time I was there. And I will tell you that consistently about 20% of our students don't drink. And although 20% may seem like a small number, in reality, that's like 6,000 students. If we have 30,000 students on campus, that's about 6,000 students who don't drink at all. And then of the 80% that do, majority of them drink in moderation. So that is a myth that everybody's doing it. There's also the myth that there are no negative consequences, because we say to ourselves, hey, we survived college, so surely they will too. Well, there are a lot of negative consequences that we're either not remembering or maybe didn't happen to us, but can happen. And certainly things like academic problems, dropouts, safety issues, especially sexual assault and rape, or negative consequences as a result of being maybe arrested or caught by campus officials. It then creates a problem that could haunt you in future career aspirations. And so there are negative consequences, and we need to help students understand that. Next slide. The thing we have to realize is that sending our students off to college is very scary. I know I've done it twice. It can be very scary because we know that they have never had this much freedom before. You know, nobody's there to make sure they come home at a certain time or do their homework or any of those kinds of things. So I know that that's scary. So I want to acknowledge that right off the bat. However, next slide, please. The reality of it is, parents and guardians, we are not done yet. It's important to know that although they're legally adults at age 18, they're still our son or daughter. And it's important that they know that you have clear expectations of them, that you expect them to do well academically. I mean, maybe they're not going to come home with a 4.0, but that's okay. You just want them to do the best they can. You want them to get involved on campus. because they'll learn so much about leadership and team building and time management that is important to get involved on campus, that you want them to make friends, and yes, you want them to have fun. You have to help them understand, you know what, it's okay to not be okay. If they're going to have ups and downs, and that it's important that they seek help if they are having a difficult time, and that that's okay. And matter of fact, it's great if they do seek help. Help them know that there are campus resources. Most likely there's a counseling center and a student health center and a prevention office, and help them know where that is and to have that phone number. And then this is the hardest one. You need to keep in contact with them. And I know that because they're going to be resistant to that. But the reality of it is you've got a telephone, you can text them, you can Facebook message them, you can call them, but just let them know, not every day, not multiple times every day, but let them know, you know what, I'm still here, I still care about you, and that will make them feel good. Next slide, please. I want to start by saying that prevention approaches are different on college campuses than they are with younger kids. Although the drinking age is 21, we're all well aware of that. We're also aware of the fact that before students step foot on our campuses, they're typically about 70% of them were already drinkers. And so to tell them to just say no, they will turn us off and not pay any attention to us whatsoever. So we need to treat them as adults. And what I'm going to do is review with you what are some of the approaches that work most effectively with students. Next slide, please. The fact that they are adults, even though their brains are not fully developed, they view themselves as adults. And so we need to treat them that way as best we can. And so we can accept the fact that many of them are going to drink, but what we want to do is teach them how to do it in the safest way possible. So for example, to help them understand the importance of eating before and during drinking, to alternate non-alcoholic drinks with alcoholic drinks, to space the drinks out to no more than 1 per hour for men and no more than 1 every about 1.5 hours to 2 hours for women, to help them understand drink sizes, how to calculate their blood alcohol content. We would literally sit in presentations and help them try to figure out how to keep their blood alcohol content at a 0.05 or below. Knowing that the legal limit is 0.08, we want them to be way below that, but help them learn how to do that and help them learn that there are negative consequences and help them know that. But the important thing is to realize that I've never been able to go in and do a presentation and have the students suddenly go, oh my gosh, I've seen the light. I will never make another bad choice. It's not that easy. We need to create as many aha moments as we possibly can throughout their college career so that hopefully on any given night, they'll make the right choice. Next slide, please. Another thing that I just love is social norming. It's the prevention approach that basically turns up the volume on good behavior. It dispels the myths that we have about college student drinking and drug use and a lot of other issues. And so what we do is, as I said, we collected a lot of data on our campus and on our students. And we would ask them about their use, and we'd ask them about what they think of other students' use. And because what we know is that students tend to drink to the extent that they think their peers are drinking. So in other words, they're drinking to fit in. But the problem is they way overestimate how much their peers are drinking. So if you can educate them as to what their peers are actually doing, that they're still trying to fit in, but they're fitting into a safer level of drinking. So next slide, please. Here's a perfect example of when it comes to tobacco use. We know that 88% of MU students would prefer to kiss a non-smoker. Now, if I was standing in front of a group of students and I'm trying to convince them to either not smoke or to either quit smoking or stop smoking or never start, I could say, you know what, you're going to get lung cancer or emphysema. And, you know, immediately, especially because they feel nothing bad's ever going to happen to them. They're going to think that's going to happen to a 60, 70-year-old person. That's not going to happen to me. But if they know that, hey, you know what, tonight, 88% of MU students would rather not kiss you, that's going to make a difference. They're going to pay attention to that. Next slide, please. Then we also knew based on our data that 77.9% of MU students prefer to hang out with people who are drinking moderately or staying in control. So if my misperception is that people will think I'm cool if I go get drunk, And I find out that almost 8 out of 10 students would think it's cool if I drank in moderation and I stayed in control. Then I'm changing my misperception and realizing that what is cool is to stay in control. Next slide, please. We also know that consistently every year, the #1 reason why a student wouldn't drink on any given night were academic obligations the next day. And so let's say I am sitting in my residence hall room on a Thursday night. I have a test tomorrow and my friends come to the door and they're knocking on the door saying, come on, Kim, let's go out and drink. Come on, everybody's doing it. And I remember seeing this poster that said 3 out of 4 students would not drink if they had academic obligation the next day. Then I'm going to feel empowered to say, wait a minute, no, not everybody's going out and drinking tonight. I have a test tomorrow. I'm going to stay home and I'm going to study. And so social norming can be so powerful because it really uses peer pressure in a sense, but it's positive peer pressure and is toward an much more accurate and safer norm. Next slide, please. I also love the prevention approach called Bystander Intervention. And that's helping students take responsibility, not only for themselves, but for other people. So next slide, please. I would always ask in presentations, by show of hands, how many students have seen somebody who's had too much to drink? By show of hands. Or how many of you have seen somebody who you know was taken advantage of sexually? Or were a victim of hate speech? Or you suspected might have an eating disorder? Or someone you knew seemed very depressed? And I would have a show of hands on all of those. I would say the first one and the last ones were the most significant as far as showing of hands, which is why this presentation today is so important. But what I want students to do is to realize that they are noticing this kind of behavior. So next slide, please. So I want students to appreciate the fact that everybody matters, that everyone is valued and committed to making a difference. And everyone needs to know how important it is to look out for each other. So it's trying to create a culture of kindness and civility. Next slide, please. And basically, it empowers students to be part of the solution because the people students are going to listen to the most are their peers. And so if we can empower the peers to know first what to look for, so the detection aspect of it, that they feel a responsibility to do something about it, and then they can safely intervene. So if a student sees somebody passed out from alcohol poisoning, they know what to do. So if they see somebody, a man trying to get a female intoxicated so that he can take advantage of her, that they would try to get her out of that situation. Or they see somebody who's been drinking all evening and they're grabbing their keys, and instead the friend would walk up, grab their keys and say, no, not on my watch. You're not driving home. I'm going to find you a safe way home. So there are a variety of different ways in which students can intervene to look out for each other. But what it really boils down to is our ability to educate our students to notice, feel some responsibility, and then take action. Then next slide, please. Environmental management is where we all enter into the picture. Next slide, please. Because basically it takes a village to raise a child. Every one of us has the responsibility to create an environment that supports good decision-making. Because we can educate students all we want on how to make good choices. But if they walk out into an environment that says, go for it, then that really creates a difficult situation for us. There's a saying that says, you can't blame a fish for dying in a polluted stream. We need to make sure that our environment is not polluted, that we are taking every precaution to help create a positive environment. And so that means parents and guardians, that means faculty members, that means staff, that means law enforcement, that means community leaders, that means businesses. All of us need to take part in making a better, safer community. A perfect example of this would be smoking. Several years ago, several of us worked very, very hard to make all the bars and restaurants smoke-free. That has made a huge difference on the smoking rates of our young people. Now the entire campus at Mizzou, inside and out, all smoke free, and our smoking rates have significantly decreased. And so when we can create an environment that supports good decision making, then it has very, very, very positive results. Next slide, please. And so basically what works best is a combination in all of everything we've talked about. Good prevention, so good education, then good policies and practices, and good policies and laws, rules, law enforcement, but also good practices. Practices meaning good role modeling, good messaging that we're putting out there, and good expectations of our young people. All those things together make a strong three-legged stool. But if one of those three is missing, then that is not going to be as strong as it needs to be. And so that's why all of us need to work together the best we can to create an environment that supports good decision making, and that we're all understanding that we're all part of the solution. So last slide is to see if we have questions.
Let's see. So this is Barbara Hoppy. And so far, we don't have any questions. Thank you so much. That was very thorough and wide-ranging. And I'll give people a little bit of time to enter questions if they have some that they haven't had a chance to ask. And I thought I would do two things while we're waiting for additional questions. One, I wanted to just ask the speakers, I'm curious at whether, this was so good and so wide ranging, that whether you are doing presentations with teachers and schools and churches and other civic organizations. I was just curious about that. I think you might be muted, Kim.
Well, I wanted to put a commercial in for places like Compass Prevention and University Extension. And there are several places, several groups at the university who have some pretty sizable grants that can help educate teachers and parents. And we have wonderful things like youth mental health first aid, QPR training. There's a lot of excellent trainings out there. And I would encourage folks to honestly contact Laura at Compass Prevention and folks at University Extension, because there are a lot of opportunities out there to be educated.
Thank you. And we do have some questions now. Let's see. One question is, are there CIT trained officers in Boone County?
I'll go ahead and answer that. That yes, about a third of the law enforcement in Boone County, the Sheriff's Department, the Columbia Police Department, and the campus security all have CIT trained officers. So Boone County's done a good job. It's costly. Somebody has to cover those shifts while they're getting a 40-hour training. But we appreciate the visionary leadership in Boone County so that we have more law enforcement trained for that.
Right, and that was crisis intervention training. Thank you. We have another question. Is there anything you can share about the way COVID has impacted the mental health of our school-aged kids?
Laura, do you want to handle that, or you want me to jump in, or what?
I can start, and then you can add some more information. Yes, we know with what we've heard about social media before COVID, youth mental health was struggling already, and COVID removed some of the supports that are there consistently for students, like school. School's a fantastic support system. And when they got pulled out of school for COVID, that made it more difficult. They were disconnected from their friends because of COVID. So yes, it has really brought to the forefront that there are a lot of people, especially young people, struggling with mental health. And that's one of the reasons that we're having more of a conversation about it and trying to figure out what we can do to support these young people.
And I would say that anecdotally, I've heard about, about 30% higher rates of behavioral health showing up in doctors' offices. And there's not, I've heard of really nightmare incidents where a teenager needed hospitalization and there was no place, and they would spend days in the emergency room. Again, as Laura pointed out, we were having a difficult time before COVID. This is really by children's mental health professionals. This is the second pandemic, is children's behavioral health. We adults have been hit really hard too, but we have more coping skills. Even if we've never been through anything like this, we have more coping skills. Children don't, and for teenagers, everything is today. There's nothing else. They can't see past it. So what's happening now seems like it will go on forever. So it's impacted them greatly on all sorts of fronts.
Thank you. Yeah, we have several more questions. One question is regarding smoking, and that smoking is worse than alcohol, and they may have misunderstood the point.
Right.
Does someone want to speak to that?
Well, I think the point I was making was that teen brains are immature and they're much more vulnerable. About 90% of any addictions begin during adolescence. So anytime a young person, a young brain is exposed to alcohol, tobacco, or other drugs, there's a much higher vulnerability. So which is worse, to expose a young teen brain to either or any of those is not a good idea, and it's a high risk situation.
Okay, thank you. And another question, what about peer groups addressing these issues? What is your opinion about these at the high school and college level, and what oversight is needed?
Yeah, I can answer that one, because that's something I feel very, very strongly about, and that's the impact peers have on their peers. And at the university, we had extensive peer education. Students would rather hear from another student than they would, say, me. And so we would educate our students to then go out and do presentations in the residence halls and fraternities and sororities and things like that. And so peer education is so powerful. And then it's also could be powerful in the high schools. So we have at all three of the high schools, we have kindness ambassadors. And they're just absolutely wonderful high school students who do educational outreach events at all three of the high schools. And we're trying to expand it to some of the other high schools as well. But Hickman, Rockbridge, and Battle, all three have them. And excited to say we have some tremendous kindness clubs that are in the middle schools and many of the elementary schools. And so Children's Grove is very committed to trying to help those groups flourish, and we have some outstanding educators, outreach counselors, and a woman named Sarah Greenlee at Gentry Middle School who has lesson plans and everything all ready for kindness clubs. And so students impacting students is so, so important.
Oh, thank you. And let's see, I wanted to mention that we have well, I'll go to this next question. Someone asked, oh yes, how can one know that suicidal thoughts won't lead to action?
We really don't. There is a point where thoughts become actions, and we want to intervene way before that point. But sometimes it does get to that point. Warning signs can be really hard to spot sometimes. They can be really subtle. So if you're unsure, it's important to call a crisis line. Calling a crisis line does not mean that they're immediately going to send an ambulance. They can talk you through it and talk through what you're seeing. And if you're the person who is in crisis, they can talk through what you're thinking and what you're feeling and help you make the best decision. And the best decision sometimes is to go to the hospital or to call 911. Other times it could be to call a friend, and then to, in the morning, make an appointment with a mental health professional. You can walk into many places that provide mental health, like Compass Health offices is one of them. During business hours, you can walk in and talk to a professional to do the start of the assessment process, but really just reaching out to those professionals if you're ever unsure, because it is better in these cases to overreact rather than to underreact, because there are lives at stake. So just make the best decision you have with the information given.
Well, and I think there also, you might look at sort of layers of what to be concerned about, because there may be a general, I just don't want to live anymore. But when you begin to ask, have you thought about killing yourself? Then they may offer, yes, specifically, have you thought about how? No. So there's that level. But if they thought about, yes, I would take sleeping pills. Do you have any? Would you, we're like, yeah, my mom's got some. I know where she keeps them. Okay. Those levels of, if you thought about using a gun, yeah, and my dad's is, I know where it is. I know the combination to the safe. I know where he keeps the ammunition, whatever. So when ease of access, so if they have the ideation, they have a plan, and they have access, now you are much closer to a full-blown emergency. So looking, kind of weighing those levels. And then again, access is huge. When they have access to lethal means, then that's much more likely that it will happen. We have more Missouri veterans die of suicide with guns than have perished in combat in the last few years. So looking at that access is a very important key for the policies that Kim talked about in terms of policy as part of it.
Thank you, Heather. We have another question. And I think this one's for Kim Dude. It says, I'm wondering how the last speaker, they put this on earlier, would work with MU or worked with MU faculty and staff to help them buy into being part of the village.
Well, I will say I tried. I can't honestly say I was terribly successful at it. It's a very hard group to have access to. The closest we came was we had a program called Don't Cancel That Class. So if a faculty member ever couldn't in class for any reason, they could call me up and I would drop whatever I was doing and I'd go and I'd teach their class. And of course, I wouldn't teach their subject matter. I would do a responsible decision-making kind of a presentation. And that was good because those students didn't come to hear me. They came because they had to be in class. And so that I wasn't preaching to the choir at all in that situation. And what that led to often was it went from being a substitute teacher on any given day to being a regular presenter semester after semester. So I love doing those kind of presentations. And so there were some faculty who would really help, but I'll give you an example of one thing I tried to do but wasn't successful, but still think is important, is that if academic obligations the next day is the #1 reason why students don't drink, then we need to have more classes on Fridays. We need to have more tests on Friday and more papers and projects due on Friday. Of course, that's very unpopular with students. And honestly, it's unpopular with faculty too. But that's something that I felt very strongly needed to happen and still needs to happen because faculty have, in a sense, more power than almost anybody else to regulate when students drink and how much they drink.
I would, before we go on to that next question, well, never mind. Go ahead, Barbara. Go ahead.
Oh, no, I was just having a comment. I was thinking naturally, if you had the tests on Mondays, that they would have to study over the weekend or at least on Sundays more.
Yeah, they would wait till Sunday. And the bottom line is most of our students drank on Friday and Saturday nights. Most of them did not drink during the week, but the highest drinking level of any of the nights other than Friday and Saturday was Thursday night. And so if we could possibly get more tests and papers and things like that due on Friday, that number would decrease. And at least then there would be, it wouldn't have as much of an impact on their academic success.
Thank you. And Heather, you wanted to.
Well, I think it also kind of ties into wouldn't Douglas students benefit from peer groups? So peer group has a great influence. I want to go back to the idea of policy, also sort of the universal protection. A question I ask most audiences is, where do young people, underage young people, get alcohol, tobacco, and other drugs? And often people will say, well, from their friends. And I say, and where do their friends get it? If you trace it back, their access to alcohol, tobacco, and other drugs always comes through the hands of an adult. Always. Yeah. So even I had one client say, well, My dealer was a teenager. I said, and where did that teenager get it? From people who are old enough to know better, who are more interested in making money than who are interested in protecting teen brains. So looking at when we have policies that have more for example, tobacco 21, where now you don't have 18-year-olds who have tobacco that they're going to give to their friends hanging around high schools. Not a whole lot of 21-year-olds are hanging around high school campuses. So we expect that the research has borne out that in other places where that's been implemented, then the smoking rates drop. So looking at policies in our community that make it harder, where we're really enforcing carding, we're really enforcing access to that. So adults are the ones who are managing the environment. We're still expecting a 16-year-old to manage the environment, right, versus the adults taking responsibility, having the policies and enforcing them, right, because that protects everyone from more addictions, which are devastating in our community and is a horrible tax burden to us as citizens.
Well, thank you so much. And we're running out of time. I just wanted to let everyone know that there are a couple good resources that were put on the chat feature. So you might want to check that before you sign out. And I also wanted to share with people that next week we're having a special lunch and learn on Tuesday, October 19th, a special lunch program with Mike Briggs, who's the director of the Parks and Recreation program in Columbia. And he will talk about the parks tax, which is the only issue on the November 2nd ballot. So join us next Tuesday, October 19th for that. And then next month, our Lunch and Learn program is on November 9th. And it will be on paid family leave. And Alice Kitchen, who's with the Kansas City League of Women Voters, will be presenting that. So we have a couple programs coming up. Thank you again, Kim Dude, Heather Harlan, Laura Powell, and the Children's Grove for your presentation today. And again, this will be available for people to look at again and to share with friends and family on YouTube at the League site, the League of Women Voters, abbreviation, cbc.org. So thank you so much. And hopefully we'll address the problem slowly but surely. Thank you.
Thanks, everyone.
Thanks, everyone.
Great opportunity. Thank you.